children who were vulnerable for poor outcomes. And I had a wonderful career and really got to work on a lot of issues. And I was blessed to have a retirement for a few years, although I was still very involved in the community. But I was missing something. I was missing that commitment to make a difference in people's lives. So joining the AARP Foundation was quite interesting, and every day I go to work, I learn something more about the plight of the struggling over 50. I think when I look at my career, I had the good fortune to work on issues around children, now issues about older Americans, which I'm one. That was a joke, okay? When I joined the foundation, I was appalled and shocked with the numbers. You all know the numbers as well as I, but let me just review a few. There are 9 million people on a daily basis, 50 and older, who are struggling with the issue of hunger. We see this as a social injustice issue, that no American should be going to bed hungry. And we know that for children, there's some safety nets there because they go to school. But for many, 50 and older, this is a problem because there are no safety nets. We're doing some very interesting work in our isolation area because we know for this age population, many times when you're not working, you're not going to church anymore, you're not participating in activities in your community, you become isolated, and your world gets smaller and smaller. 4 million of that 9 million are 60 and older. So we have government programs that help the 60 and older, but that difference are falling through the cracks. It is an issue that isn't really talked about. We know that from 2001 to 2009, the numbers of adult hunger have increased 79%. It's an epidemic. And as we are coming through this job recovery period, we know that many people in this population that we're working with will take Social Security earlier as a bridge, but it's 25% less if they had waited until 66 to start drawing that Social Security benefit. I think for the Latino population, as well as the African American population, we're seeing hunger issues really showing up in families where grandchildren are being raised. And that is becoming a large group of people in this age group taking care of the next generation and sometimes 2 generations. And geographically, we know that while food insecurity is found all over the United States, there seems to be no state that is free of this issue. We certainly know that the South and the Southwest areas experience higher rate of adult food insecurity. We have some fact sheets at the table, and I would encourage you to pick one of these up that we've done, and it shares what the older adult risk of hunger population is for your state. So this is a good tool, and it's also on our website, so you can find it there. We're doing some really interesting work, as mentioned before, under this umbrella of Drive to End Hunger. And yes, part of it is working with NASCAR, but it's really a program to raise awareness around adult hunger. And we do have the sports car, but again, it's a way for people to engage on the issue, working with you all and your magazine and your programs. This is another way to engage. We have to keep this conversation continuing. Some of the work that we're doing in the foundation under this umbrella, we are doing SNAP enrollment, really helping people who are available for SNAP benefits to enroll and using a peer-to-peer model. We know that the baby boomer generation doesn't really want to self-identify that they're in trouble. many times think that those programs, SNAP and TFAP, are programs for other people and don't realize that they are eligible for it. Of course, as you know, SNAP is a very tedious process. I was meeting with someone in California the other day, and I didn't know. Every county in California has a different application. And if I understand, finally, if you move from one county to another, you can transfer, but that's a new change. So it is an impediment for people to get a benefit that they are entitled to. So we're using a peer-to-peer model. We have about 250 volunteers that go and talk to their colleagues, their contemporaries, and are able to talk about the program in the terms that are most familiar as opposed to someone coming in and talking at somebody. So that we're very pleased about that. We just are getting ready to publish on our website, and you can look for it probably in the next 60 days, a food insecurity risk modeler. We took 33 factors to understand what is going on in the United States that is driving food insecurity at the county level. This is very powerful research that has been done. I think there are 3,100 and some counties, and you'll be able to go onto our website and see in the county in which you're working, the county that you are interested in, to find out what are the factors that are causing food insecurity in your area. It could be lack of transportation. It could be no grocery stores. We were a little surprised that, well, we were very surprised to find out that the #1 factor for food insecurity is lack of health care. And maybe we shouldn't have been so surprised, but certainly we know that food insecurity is a problem when people have to decide whether they're going to buy food or take medicine. So I look forward to that. I also wanted to take this opportunity to share, we have 10 innovation grants around the country with different populations. So we went out and seeded 10 organizations to find out what they're doing with different groups so that we could see if there was anything that could be replicated, anything that could be transferred. And we're getting, this is the beginning of our second year in this, and we're getting some really rich data so that we hope at the end of this year we will be able to take some of these and lift them across the country. For those of you who work and know of Washington, D.C., you know we have been very fortunate to have a visionary leader in our midst, Robert Egger, who started D.C. Central Kitchen. Do you all know of Robert Egger? Well, he recently resigned from D.C. Central Kitchen and is now getting ready to start L.A. Kitchen. He was asked by the mayor of Los Angeles to come out and create a program there. And what's interesting about this program, it's not a typical food bank program. He is going to take the fresh fruits and vegetables from the California growers, package it, freeze dry it, so that he is able to deliver fresh, well, healthy and fresh food to seniors. His population in this program will only be 50+ people, and so we think this is going to be quite innovative. He is working on developing a drink that will be somewhat like Ensure or Boost, not that I'm giving them a plug, that will be healthy. So as you can see, it's not just about serving the food or providing the food, but also making sure that it's nutritious and healthy for the population we're serving. So we're very excited that that will be launched in 2013. So stay tuned and hear more about that. You know, this issue of adult hunger is very serious. 10,000 baby boomers are turning 65 every day. The silver tsunami is on its way, and we have to be prepared. I think having a conference, a summit like this is so important because it brings all of the different segments of our population, government, nonprofit, faith-based, to talk about the issue for children, for seniors. It's very important, the work that you will do today. So I want to engage and invite you to go to our website and see what we're doing, to fill out the cards, as was shared earlier, and tell us what commitment you're ready to make, and more importantly, what can we do to help you as you work on this issue of hunger in America. Thank you.